Ziaa, I wanted to sort of talk to you about what I think came out in the presentation from HT Parekh as well, about making ecosystem interventions as opposed to a welfare model. So what are the challenges that do you face as a funding agency when you're attempting to make ecosystem interventions in the context of creating accessibility for persons with disabilities? And here we are talking about working with not just groups that are specifically dedicated to disability organizations, but as we saw in this white paper, we are talking about literally every stakeholder group that's out there. We're working with citizens, architects, and like a variety of disciplines that is not usually seen as specifically to do with accessibility. So I just wanted to hear from you about a little bit about your thinking on this topic and any challenges that you faced in attempting to bring about interventions at this level.
Yeah. Okay. Thanks, Neha, for that. So if I actually just stepping back a little bit on your question, and I'm wearing a funder's hat right now and talking, I think the biggest challenge is, there are sectors like education today where so much is being done at a systemic level and, at a state government level, at a central level, but and now probably, followed by healthcare. Unfortunately, for interventions in the sector of disability to even come to the systemic level, two things are needed. First, I would say you need funding to come in. And it's not something which you can only depend on the government. You can't depend only on the corporates. It's a collaborative approach where I think corporates have, firstly, many more corporates have to come to the fore and recognize that with this thousands of crores of, CSR money, and that's just one pool of money. You have India today, young philanthropists, you have family foundations, so much of money coming into supporting various interventions, but very little towards disability. So for us, we may have been one of the few who actually have even reached the ecosystem level. There are, but we face this challenge all the time with our partners who say that, please introduce us to other corporates. Now, the problem is if funding doesn't come out and you don't do pilots like this Vidhi report, or what we've done, like we've done like all the 4 interventions that Sweetie spoke about. So I think corporates firstly need to come out in much larger numbers to support the sector. They have to showcase pilots. And when the pilot works, I think there's a lot more confidence both at the government level as well as other corporates who've seen that, something has worked. And then more people step forward. And we've seen it. Some of the interventions that we've done, we've seen that, other corporates then become receptive when they see that positive change has happened and something has worked. And then, they come forward, and that is only helping the sector. But I think this sector to even reach the level of systemic change and, bring about real ecosystem, I think we still have some way to go because, a lot of critical issues, like, for example, let's just talk about life care. Right now, when a person with disability reaches, say, their 40s, and I'm talking of somebody either with physical or intellectual, when they're in their 40s, mid 40s, early 50s, their primary caregivers are already in their 60s and 70s. The siblings have moved on with their life. Now, even in terms of institutional support today in our country, like you see in Western countries, there's so much of institutional support, public support for even things like, senior citizen living, old age homes for people like this. They are there, and it's part of, and it's established and built. Those are the kind of ecosystem interventions we need. Where is this 2% population, and the number is of course much higher than the 2% that we talk about. Where are those kind of institutions being created to support these people when they reach, when they reach their mid 40s and 50s? Similarly, livelihoods. If you look at the whole ecosystem of livelihoods, actually having corporates hire people with disabilities, integrate them into the system, the entire corporate setup, train people to accept somebody with disability working with, and it has to be done with dignity, at par, salary at par, competence at par, dignity at par. Okay, you get hired for your capability and not because you're a person with disability. Now, these are all mind shifts, and which are going to take a lot of time to be even thought about, to bring about a big paradigm shift in the system. So, I mean, there's a long way to go, but I think corporates coming out and being more proactive, and I think far more funding going into the system to start with is really needed. Now, some kind of push needs to happen at a government level, at state level, at municipal level, to actually and try and bring out more support for the disability sector. And because there is enough money available in India today, it's not that there's a lack of money, but I think it does tend to go into education, healthcare, maybe now, sustainability initiatives. It's not going into this sector. And the government can't put out all the money, and neither can one corporate or even 5 corporates put out the funding. Also, collaboration in this entire development sector in India, this collaborative approach is not, it has to happen. So you want to do something, even to change something systemically in Karnataka, by, let's say, bringing about policy level changes, you need to have civil society, corporates and government working on a collaborative approach together. It's not about, who wins the game, but it's about ensuring that it at least kickstarts. And I think we've seen across so many other sectors, one pilot works. And like, for example, what's being done with schools in Delhi by the Delhi government. Now, so many other governments are, taking on similar approaches to build up the public school system. So it's that one intervention which needs to work, and then, it gets replicated. It's only when you see success, it gets replicated, but people don't want to, put out the funding to say that, okay, if it doesn't work, then what? Like, they treat it like, what happens then? But you have to take that risk. Like you would do in business, you have to take that risk, and you have to actually believe in the people who are behind that venture, or who want this to happen. And things may take time, but I think, if you have a good set of people, you work collaboratively, it will happen in time.